talking to you about the use of FBDGs to inform policies and programs for food system transformation. The outline of the presentation is first, what are FBDGs, where I will be discussing A, the history and evolution of FBDGs, and B, what are they and what they are not. Second, some very broad aspects on the development and implementation on FBDGs to inform food systems. Third, the potential of FBDGs, and fourth, take-home messages. So, what are FBDGs? As you may know, humans can thrive on vastly different combinations of foods. In part, our ability to adapt to so many different habitats has been enabled by our capacity to combine a great variety of foods to create diets that keep us healthy. However, if we can eat a lot of different foods in different ways and patterns and thrive, how do we know a healthy diet from an unhealthy one? Well, we know that bad diets are a significant risk for disease and death in both men and women. The Global Burden of Disease Risk Factor collaborators estimated that 1 in 5 deaths globally are associated with poor diets, that is, diets that are, for instance, low in fruits and vegetables, high in processed meat, low in fiber, high in sugar-sweetened beverages, etc. And that diet contributes to a range of chronic diseases in people around the world. For centuries, dietary advice has been included in different texts, religious, medical, and philosophical. For instance, Plato recommended a diet rich in cereals that included fruits and vegetables and preferred fish and dairy to meat. Moderation was a major principle in Plato's writings, as excesses would result in disease and early death. Dante also reserved the third circle of hell to the gluttonous, those with insatiable appetites who overindulged in food, drink, and other addictions. However, since the 1800s, medical and nutrition science started to play a larger role in the provision of dietary advice. Then, countries started to advance public health, providing dietary advice, and adopted a more systematic, evidence-based process that evolved into national dietary guidance. At the same time as nutrition science and the science of dietary behavior evolved, dietary guidance changed. Early dietary guidance was based on foods, but a period in the second half of the 20th century was marked by dietary advice focused on nutrients and ingredients, with messages such as avoid too much saturated fat and cholesterol and eat foods with adequate starch and fiber. Back in 1992, in the International Conference on Nutrition, the first one, the focus changed from these nutrients and ingredients to foods, with a call for countries to develop food-based dietary guidelines. As a result of that call, and to support countries, FAO and WHO in 1995 organized an expert consultation to define the methodology that could be used to prepare and use food-based dietary guidelines. From that consultation came this 1998 publication, and then further guidance. But in 2014, in ICN2, there was a renewed call for the development and implementation of food-based dietary guidelines for the promotion of healthy diets, and with the United Nations Decade on Nutrition in 2016, FBDGs became also part of the range of actions that could be used to put an emphasis on nutrition. And so, FAO, GLOPAN, and others advocated very strongly for the development and revision of food-based dietary guidelines and their implementation since 2017. There has been accelerated country support from FAO since then. And then from 2018, we have engaged in a revision of the methodology because we identified a few areas where guidance could be clarified or expanded. This year, food-based dietary guidelines have been identified as a game-changing solution for the UN Food System Summit. So what are FBDGs? So let me start by saying what they are not. They are not a list of recommended or restricted foods. They are not general dietary guidance. They are not dietary recommendations for clinical populations. They are not standalone pictorials or graphics of food groups or standalone messages. They are not institutional meal standards or publicity for a specific food or food group. So, what are they? Basically, FBDGs constitute multi level recommendations for healthy diets and hopefully also sustainable healthy diets, since some countries have started to include sustainability. They are a multi-sectoral, multidisciplinary process, and they result in a package of outputs and resources that I will be addressing and talking about later on. FPDGs are both the process and the recommendations that come out of the process, and of course, the different outputs and resources that also result from the process. So, what do they do? They outline what a healthy diet represents in a country or region. As I mentioned, they involve the multi-stakeholder systematic approach for the development and implementation and review and update. They provide advice for the general public, guidance for a range of policies and programs, as well as actors all along the food system. They are based on the best available evidence and analysis of the context, and they result in a package of outputs and resources. They are popularly recognized by the simple messages and recommendations and by a graphic guide, and they are directed towards a range of groups, policymakers, professionals, or target population groups, depending on what is produced and how are they intended to be used. So what is that package of outputs and resources? Some of the things that come out of the process are the evidence review situation analysis document on which FPDGs are based. There are also technical recommendations that explain what the diet would be that makes the target population healthier. They are also included optimized dietary models that could be used for other purposes, actionable messages for different target audiences, the food guide, the food graphic, guides and manuals for different target audiences. Then there is the implementation strategy, implementation activities, as well as dissemination strategy and materials for information, education, and communication. Here are some examples of those outputs, for instance, the evidence review, the messages, the food guide, guides and manuals for different audiences, implementation strategies and plans, and much more. So how do we better develop and implement FPDGs so they are actually able to inform food system policies and programs? Well, there has been a change of focus. As I mentioned in 1998, when FAO and WHO guidance first came out, undernutrition was the main concern. And so FPDG messages were mainly on dietary diversification, and the focus was very much on consumers. Now, 20 years later, we have the multiple burden of malnutrition. We seek, as I said, for FPDGs to inform policies and programs all along the food system. There is this food system approach and a discussion on food system transformation, and with the SDGs, sustainability concerns related to diets have become very salient. Therefore, we are now seeking to change how they are developed and implemented to address these new concerns. To increase their effectiveness, then we need to use a socio-ecological model and the multi-sectoral, multi-stakeholder development and implementation process, and these both tie very well with a food system approach. So their potential is very vast. If we want FPDGs to inform and guide policies all along the food system, including agricultural policies, food environment policies, financial policies, health policies, and set also a basis for programs, for instance, food and nutrition education programs, social protection programs, obesity prevention program, agriculture programs, workplace well-being programs, and others, we want that to happen through this multi-level, multi-sectoral implementation. So involving others is quite important. And that is when we need to also develop implementation guides and guidelines for different sectors, media packages, monitoring and evaluation tools. And we can use FBDGs and their development process for multiple purposes, including the development of assessments like scores and indexes of healthy eating. We can also use the diet modeling to assess the cost of healthy diets. And also we can use FBDGs to set research portfolios. I want to end with a few key messages. First, FBDGs have a vast potential to promote healthy, sustainable diets by informing policies and programs throughout the food system. However, for this, FBDGs need to be better understood, developed, communicated, used, and evaluated. The SDGs demand that FBDGs consider sustainability. More than 100 countries have developed FBDGs. It is high time for those countries and others to use them to their full potential. I leave you with a question. Now that you know more about FBDGs, how would you use them to transform food system? To learn more, please visit our website.